Hello everyone and welcome to Nairita's Talk, dedicated platform to help you all find the right insights and the right information in the beauty and aesthetic world. Bringing education, sharing the latest technology, and introducing you to the best doctors. Today, we're very fortunate to have Dr. Jens Bengaard visiting us all the way from Denmark. Hi, Doctor.
Hi.
Hope you're enjoying Dubai.
Yes, I am actually. Yeah, I love it.
Okay. Doctor, tell us more about your career path and who is Dr. Jens?
Well, I've been a doctor for 20 years and I've been in surgery almost all my career and in plastic surgery for, well, since 2005, so that's 15 years. I specialized in the beginning of my career in microsurgery, reconstruction microsurgery, and did a lot of body contouring and breast as well. But now I'm in private practice, been for a couple of years now, doing mainly aesthetic surgery, and my main area is breast.
Today we'll be talking about the difference between the implant, the breast implant, and the fat transfer. So can you tell us more about this procedure, Doctor?
Well, the fat transfer has become increasingly popular in the last, 5 to 10 years perhaps, because there's been more focus on what it can do to you, and it's been easier to do the large volume fat transfer, so it's been possible to do a breast enlargement just using fat. It wasn't really that easy doing that a couple of years ago. The thing about fat is that it's your own body, and it doesn't give you the problems that you sometimes see with implants. So it feels more natural, it's a more friendly procedure, you can say. And you have the advantage as well that might be a secondary thing with if you have extra fat, for instance, on your stomach, you get rid of that as well. So it's kind of like two procedures in one.
So you just take the fat from your stomach and inject it in your breast?
Yeah, basically you can take the fat from anywhere, but usually you will talk to the customer, where do you think that you have extra fat? Yeah, often the stomach area, but sometimes the thighs, the outer thighs or the inner thighs, or the back, so whatever. The main issue is that you actually have enough fat to do a real difference in the transfer.
So what are the side effects in fat transfer?
Well, there is not a whole lot of side effects. There is a couple of things that you have to consider. Mainly that it's very hard to predict exactly what the volume is going to be. That means if you inject, for instance, 300 or 400 cc's of fat in just one breast, you're not going to end up with 300 or 400 cc's of extra volume in that breast, because some of the fat is not going to stick. Yeah, it's going to go away. So that's one of the issues. So you usually are, it's often that you need to have more than one procedure with perhaps 2 to 3 months apart. So that's one of the, you can call it side effects, but that's one of the things you have to consider.
And what's the duration of the procedure?
Well, if, for instance, if it's a bilateral fat transfer for a breast enlargement and you have to have all the fat from the stomach, it will take about an hour and a half, something like that. It'll take maybe 30, 45 minutes to do the liposuction, and then you have to prepare the fat. That might take 10 to 15 minutes, and then you have to inject it very carefully throughout the breast. So.
What do you mean in prepare the fat? Can you explain us more?
Yeah, it's when you do the liposuction, there's fat, but there's also some blood, there's some fluid, there's some oily parts of the fat that you don't really want to use. So you have to separate these components so you have the nice, clean fat. And you have to put it into small syringes and stuff like that. So it takes a little, well, not too much time, but it takes 10 to 15 minutes to prepare the fat.
Doctor, if you have any complications happened during or post procedures, surgeries, how do you deal with it?
Well, the main thing is that you talk to your patients beforehand, you let them know what they can expect, and you let them know what is abnormal, so they'll recognize when they go home if there's any problem. Usually you'll see some pain, you'll see some bruising, some swelling, that's okay, that's not a problem.
So this is the common...
That's common when you do these kind of procedures, and people should be aware of that, they shouldn't be worried about that, that's okay. Then if there is, for instance, a larger swelling, more pain that they feel is acceptable, then the best thing is that if they have a direct line, they can call you or the clinic. Sometimes it's just enough to talk to the patients, let them know this sounds okay, this is not a problem, or else they'll have to come and visit you. So usually I do routinely close follow-ups just to let them know that everything is okay. Even though if there's no problem at all, it's a good thing to see your patients seeing, well, this swelling is okay, this bruising is okay.
And I'm sure the patients also will feel more comfortable to
Exactly, a lot of people like that.
The doctors more often. But you know, I always hear the frustration and the confusion of people where they always ask me like, where to go? Who's the right doctor for me? I mean, what is your advice on this?
Well, sometimes people come to me because they were referred to me by some other patients that I had, and they liked what I did and they didn't trust me. Sometimes they'll just come to the clinic because that's, you know, the nearest or the closest or whatever they have. We have an opening or something like that. I think the main thing is talk to your surgeon, try to understand what the surgeon can do for you, try to listen to what the surgeon is telling you, and try to feel if this matches what you want. If you don't really get that connection, go to somewhere else.
So you feel the chemistry.
Yeah, exactly.
So it has to be that kind of comfort between the doctor and...
Because there's a lot of surgeons, right? And a lot of surgeons might do a good job, but some is better than others. That's, you know, how it is. I mean, I'm not saying that if you come to me, I'll be the best. I mean, my neighbor's plastic surgeon can probably do the same kind of procedure, but you have to trust that I'm the one that can do it for you, okay? So you need to feel that I'm listening to what you're saying and that I'm actually gonna live up to your expectations.
And the trust, I think. Even
trust is very important.
Is very important.
So, and if you don't trust your surgeon, if you don't feel comfortable with your surgeon, just go somewhere else, because there's a lot of clinics, there's a lot of great surgeons out there, and it might take, you know, a little extra time to find the right one, but that's definitely worth a while.
Doctor, what are the latest trends for 2020 in plastic surgery?
Well, in my practice, I see mainly women coming for breast surgery or for body contouring procedures. And what I'm seeing more and more are people who want to combine these procedures. That means they want to do what's popularly called a mommy makeover. But I mean, you don't have to actually be a mom to have a mommy makeover, but that's just a popular term for the...
Can you tell us more about the mommy makeover, just briefly, if you can just...
A mommy makeover would usually be some kind of breast procedure, either a breast lift or a breast enhancement or a breast enlargement, combined with some kind of procedure on the stomach. That's usually abdominoplasty or some liposuction. And the reason why people want to go for this is that if you do have some kind of problem with maybe your breasts are a little smaller, they're starting to get ptotic, and you have a sagging stomach as well, maybe after childbirth, you have a problem with both things. There's not one thing you can decide, this is actually my problem, you don't like both your breast and your stomach. So usually people would like to have this fixed in one procedure because then there's less downtime, they're less away from.
So you are with doing this two procedures in one
go?
Okay. So finally, doctor, what is your favorite? I know every plastic surgeon, they have their own favorite procedure or makeover. What's yours?
Well, I've been doing, as I said, breast for quite a lot of years, and I found that breast enhancements are very fun for me to do still. Breast enlargements are, it's a simple procedure, but it's challenging to find the right implant, for instance, to the right patients. But what I find more challenging, and that is really giving me extra, I'll say, fun in my everyday work, is when I do the breast lift and implant in the same procedure, because it's a really challenging procedure, but it can really give a nice result.
Thank you so much, doctor, for accepting our invitation, and hopefully we'll see you more often in Dubai.
Thank you. I hope so.
Thank you.